Another part of standard precaution is respiratory hygiene or cough etiquette. Respiratory hygiene or cough etiquette prevents the transmission of all respiratory infections in the healthcare settings. In cough etiquette, we cover our mouth and nose with a tissue when we cough or sneeze. But due to COVID-19 pandemic, we are all required to wear masks at all times. Remember to clean your hands after coughing or sneezing. And if you use tissue, put your used tissue in a waste bin. Wash hands with soap and water or clean with alcohol-based hand rub after you sneeze or you cough. And always remember to wear your surgical mask or face mask. Remember, you have to cover your cough because it likes to travel, so it can travel up to 2 meters. Use of personal protective equipment. PPE are specialized clothing or equipment worn by an employee for protection against infectious material. We use PPE to prevent transmission of infections from patients to healthcare worker and from healthcare worker to patients. We have different types of PPEs. So we have our gloves, respirators or masks, our N95 and our surgical masks, our face shield, then we have the gown, the apron, and the coverall. We have booties, cover boots, goggles, hair cover or cap. These are the key points on PPE use. Number one is you have to perform hand hygiene before wearing your PPE. You have to don your PPE before contact with the patient, generally before entering the room. In the COVID areas, you have to don your PPE before in the donning area before you enter the COVID zone. You have to remove and discard carefully in a yellow trash bin inside the patient's room. Or in the COVID area, you have to remove your outer gloves inside the patient rooms and remove the rest of your PPE at the doffing area. You have to remove the respirator, of course, outside the room or outside the COVID area. Immediately perform hand hygiene after removing all your PPEs. Sequence of donning and of PPE. Please take note that the sequence of donning of PPE depends on the PPE that you have to wear. Okay, so first you have to wear your gown, followed by mask or respirator, goggles or face shield, and then gloves. For doffing, you have to doff your PPE before leaving the patient room or in an anteroom. And remember to remove your respirator outside the room after the door has been closed. The sequence of doffing of PPE, first you have to remove your gloves, followed by goggles or face shield, gown, and then mask or respirator. Due to COVID-19 pandemic, we have developed sequential steps in donning and doffing of PPE. This poster shows you the donning sequential steps in donning PPE without coverall. So we are only using gown. First is hand hygiene. Perform hand hygiene. Then wear your booties. Perform hand hygiene again. Then wear your gown, followed by respirator, then goggles or face shield, then wear your cap, and then inner gloves and outer gloves. For COVID area, we use double gloves. For the sequence of removing PPE without coverall in COVID areas, we have to perform first hand hygiene. You have to take note that the outer gloves are removed inside the patient's room before touching the doorknob and going out of the room. Then we will proceed at the dapping area to remove all your PPEs. First is perform hand hygiene. Then remove your gown and your booties. Perform hand hygiene again. And then remove the inner gloves. Perform hand hygiene. Then remove your cap. Then perform hand hygiene. Remove your goggles or face shield, then remove hand hygiene, and then remove your respirator and perform hand hygiene. Please take note that in removing PPE used in COVID-19 areas, staff are required to do hand hygiene every after removal of PPE. This is the signage reminding our staff to remove the outer gloves before touching the doorknob and going out of the room. It is placed inside the patient's room near the doorknob. This one is another version of PPE posters, steps to put on PPE including the coverall, and the steps to take off PPE including the coverall. Later on, you can view our videos on donning and doffing of PPE. Reminders on the use of PPE. You have to perform hand hygiene before wearing any PPE and perform hand hygiene during PPE removal. If you are assigned in COVID-19 areas, you are required to perform hand hygiene every after removal of each PPE. And please do not go inside the COVID-19 units if you are not wearing full PPE. Wear PPE properly, avoid touching or adjusting the PPE. Change gloves in between patients, especially in the COVID-19 areas. Strictly follow the donning and doffing posters posted in the donning area and doffing area of COVID-19 areas or units. Discard PPE in their designated waste bins.